Hi, my name is Jacob Holt. I'm a physical therapist. Congratulations on getting a new knee. I'm going to encourage you to follow the post-surgical precautions, icing, elevating, and using compression per your surgeon's recommendations. I'll have 3 installments of these videos for you. I'm going to encourage you to perform these videos 3 times per day at the minimum. I usually go breakfast, lunch, and dinner, or morning, afternoon, and evening. It's important to perform these exercises throughout the day as opposed to just one time in the morning. It's going to provide a better result in the end. The first exercise is simple. All I'm going to have you do is 60 seconds, lifting your toes up and down, just like this. You can go as high and as fast as you can. Over time, you'll be able to slide your heels back a little bit and go a little bit further, which it'll put pressure in your knee, and you want some of that pressure to improve the motion. Second exercise, sliding to the edge of the chair. After your knee surgery, your knee is going to be bent. I would encourage you not to put a pillow under your knee when you're resting so your knee doesn't get stuck bent. All you're trying to do here is squeeze your thigh muscle, squeezing hard. Your knee won't hyperextend due to the components put in, and we want to get this straight so that your hip and your back don't start hurting. I perform this 20 to 30 times, 3 times per day. It often helps to do both legs at the same time so you could see what it feels like and try to match your surgery leg with the non-surgery leg. Third exercise, find a soft surface or put a sock on some hardwood floor. All you're going to do is try to slide your heel back. This is a better option for those that are having trouble doing it in bed. I like doing it in the chair just because it's less painful. Your goal at 2 weeks is 90 degrees. The closer you get to 100, the better off your outcomes will be. Normal knee range of motion is 135 degrees. So by 2 weeks, if you can get to 90 to 100, you'll be in good shape. Third exercise is trying to get your quads strong. All you're going to try to do is lift your leg up just like this, squeezing that muscle. You may have trouble doing this early on. You may only be able to go that far. Continue doing this. It will get better. I would do this 20 to 30 times, but if it's painful, 5 or 10 times will work too. 3 times per day. If you have any questions, comments, and concerns, you can reach out to myself or your nursing staff who will be able to guide you accordingly. See you next video.